Are you curious about what happens if you get monkeypox? Well, you're in the right place. In this video, we'll explore the ins and outs of monkeypox and what you can expect if you become infected with this rare but serious disease. Monkeypox is a viral illness that can cause a range of symptoms, from fever and headache to a widespread rash and even organ failure. It's transmitted through both animal to human and human to human contact, making it a significant public health concern. So, what exactly happens if you get monkeypox? The answer is complex and depends on various factors such as your age, overall health, and access to medical care. In this video, we'll break down the timeline of symptoms, severity of illness, and potential complications that can arise from monkeypox. But don't worry, it's not all doom and gloom. We'll also explore the various prevention and control measures that can be taken to reduce the risk of transmission and keep yourself and others safe. So, if you're interested in learning more about monkeypox and what happens if you get infected, be sure to hit that subscribe button and watch the full video. We'll cover everything you need to know to stay informed and protected against this serious disease. To understand what happens if you get monkeypox, it's important to first know what monkeypox is and how it spreads. Monkeypox is a rare viral disease that is similar to smallpox, and it is most commonly found in Central and West African countries. The virus is believed to originate from animals such as monkeys, rodents, and squirrels, which can carry the virus without showing any symptoms. The virus can spread through both animal-to-human contact and human-to-human contact, which makes it a significant public health concern. The disease can be spread through bodily fluids such as blood, saliva, or semen, or through contact with contaminated objects such as bedding or clothing. Once the virus enters the body, it can incubate for up to 14 days before symptoms start to appear. The first symptoms of monkeypox are flu-like and can include fever, headache, muscle aches, and fatigue. These symptoms can be followed by a rash that starts on the face and then spreads to the rest of the body. The rash can be accompanied by other symptoms such as swollen lymph nodes, cough, and stomach pain. In severe cases, monkeypox can cause complications such as pneumonia, sepsis, and even death. It's important to note that not everyone who gets infected with monkeypox will experience severe symptoms or complications. The severity of the disease can vary depending on factors such as age and overall health. If you have been infected with monkeypox, the virus will typically start to show symptoms around 7 to 14 days after exposure. The first symptoms are often nonspecific and may be similar to those of the flu, including fever, headache, muscle aches, and fatigue. As the disease progresses, a rash will usually develop on the face before spreading to the rest of the body. The rash starts as raised bumps that eventually become fluid-filled blisters. These blisters may break open and form scabs over time. The rash can be accompanied by other symptoms such as swollen lymph nodes, cough, and stomach pain. It's important to note that the severity and timeline of symptoms can vary from person to person, and not everyone infected with monkeypox will experience the same symptoms. Some people may have a mild case of the disease with a relatively quick recovery, while others may experience severe symptoms and complications. If you suspect that you have been exposed to monkeypox or are experiencing symptoms, it's important to seek medical attention right away. Early diagnosis and treatment can help to reduce the severity of symptoms and prevent complications. Monkeypox is a rare disease, but it is important to understand its transmission and risk factors to prevent its spread. The virus can be transmitted from animals to humans, particularly through close contact with infected animals or their body fluids, such as blood, saliva, or pus. Human-to-human transmission is also possible, especially through contact with the bodily fluids or the rash of an infected person. The disease is not highly contagious, but it can spread easily in settings where people have close contact with each other, such as households or healthcare facilities. Risk factors for transmission include living in or traveling to areas where monkeypox is known to occur, handling animals or animal products, and caring for or having close contact with infected individuals. People who have not been vaccinated against smallpox are also at higher risk of contracting monkeypox. Prevention and control measures are essential to limit the spread of monkeypox. Vaccination against smallpox can provide some protection against monkeypox, as the two diseases are closely related. Personal protective equipment, such as gloves and masks, can help to prevent transmission in high-risk settings. Infection control measures, such as isolating infected individuals and disinfecting surfaces, can also be effective in limiting the spread of the disease. Now, Let's talk about how monkeypox is diagnosed. If you suspect that you may have been exposed to monkeypox, it is important to seek medical attention as soon as possible. A healthcare provider will perform a physical examination and collect a sample of fluid from any blisters or lesions on the skin. Laboratory testing is then conducted to confirm the diagnosis of monkeypox. Polymerase chain reaction (PCR) tests are commonly used to detect the monkeypox virus in skin lesions or blood samples. Serological tests can also be performed to detect the presence of antibodies to the virus in a person's blood. It's important to note that monkeypox can be difficult to diagnose, as its symptoms are similar to other illnesses such as chickenpox, measles, and even smallpox. Therefore, a thorough medical history and examination, along with laboratory testing, are necessary for an accurate diagnosis. Additionally, it's important to rule out the possibility of other diseases, such as smallpox, which is a more serious and highly contagious illness. Proper diagnosis is critical to ensure appropriate treatment and to prevent the spread of the virus to others. Now that we know what treatments are available for monkeypox, it's important to understand that prevention is always the best option. There is currently no specific vaccine available for monkeypox, but the smallpox vaccine can provide some level of protection. The smallpox vaccine has been shown to provide cross-protection against monkeypox and has been used to control monkeypox outbreaks in the past. Personal protective equipment, PPE, is also an important preventive measure for those at high risk of infection, such as healthcare workers or those in close contact with infected individuals. PPE includes gloves, gowns, masks, and eye protection, and should be worn during contact with suspected or confirmed cases of monkeypox. Infection control measures in healthcare settings are also crucial in preventing the spread of monkeypox. This includes isolating suspected or confirmed cases, implementing strict hand hygiene protocols, and properly disinfecting surfaces and equipment. Finally, surveillance and response to outbreaks are essential in controlling the spread of monkeypox. Early detection and prompt response can help contain outbreaks and prevent further transmission. As monkeypox is caused by a virus, there is no specific cure for it. However, supportive care is usually given to ease the symptoms and speed up recovery. The treatment depends on the severity of the symptoms and the overall health of the patient. One of the main ways to manage monkeypox is to provide supportive care, which involves managing the symptoms and providing relief to the patient. This includes pain management, hydration therapy, and providing proper nutrition. Antiviral drugs such as cidofovir and brincidofovir are used in severe cases. These drugs have been shown to be effective in treating the virus in laboratory tests, although their effectiveness in human cases is still being studied. Management of complications is also an essential aspect of treating monkeypox. If the patient develops severe symptoms such as breathing difficulties, pneumonia, or dehydration, hospitalization and intensive care may be necessary. In such cases, the patient will be closely monitored, and their vital signs will be constantly checked. In addition, if a patient develops bacterial infections as a complication of monkeypox, antibiotics may be prescribed to treat the bacterial infection. It is important to note that monkeypox is a serious illness that requires prompt medical attention. If you suspect that you may have contracted monkeypox, seek medical attention immediately. Early treatment can help alleviate symptoms and prevent the disease from becoming more severe. Now that we know how serious and debilitating monkeypox can be, let's discuss what steps can be taken to prevent and control its spread. Monkeypox is a highly infectious disease, and there are currently no specific treatments available for it. However, early detection and prompt medical attention can help alleviate symptoms and prevent complications. The diagnosis of monkeypox is made through laboratory tests that detect the presence of the virus in blood or skin samples. It is essential to differentiate monkeypox from other diseases that may present similar symptoms, such as chickenpox, smallpox, and measles. The primary method of prevention is vaccination against smallpox, which provides some cross-protection against monkeypox. However, the smallpox vaccine is no longer widely available, and its use is limited to high-risk groups such as healthcare workers and laboratory personnel. Other preventive measures include the use of personal protective equipment, PPE, for those at high risk of exposure, such as veterinarians and animal handlers. In healthcare settings, infection control measures such as isolating infected patients, using PPE, and proper hand hygiene can help prevent the spread of monkeypox. Surveillance and response to outbreaks are critical in containing the disease and preventing its spread. In conclusion, Monkeypox is a serious and highly infectious disease that can have severe consequences. Prevention and control measures are essential to limit its spread and protect vulnerable populations. Remember to stay informed about the latest developments in monkeypox and take necessary precautions to protect yourself and those around you. Thanks for watching this video about what happens if you get monkeypox. I hope you found this information informative and helpful. If you did, please consider subscribing to our channel for more informative and interesting videos like this one. By subscribing to our channel, you'll be the first to know when we release new videos about health and wellness, as well as other topics that matter to you. Plus, you'll be supporting our mission to educate and inform the public about important health issues. So don't forget to hit the subscribe button and turn on notifications so you don't miss a thing. Thanks again for watching, and we'll see you in the next video.